Hello class, my name is Rich Feldenberg and I'm in your CIS 160 Introduction to Computer Programming, and I wanted to demonstrate my final project. I'm using QuickTime and I'll upload the link from YouTube to the Blackboard. So the name of my final project is Kidney Transplant Immunosuppressive Dose Calculator. And yes, that is kind of a mouthful, I know. But this is something that I think actually could help me with my working with my job. I'm a pediatric transplant nephrologist, so I take care of children that have a kidney transplant. And part of what we do is monitor them closely and make sure that they're on the correct dose of immunosuppressant medication. They require the immunosuppressants to prevent transplant rejection from occurring. And two of the medications that we use are here, prednisone, which is a steroid, and Cellcept, which is another immunosuppressant medication. When they come to the clinic, which can be anywhere from every 1 to 2 weeks to every couple months, depending on how they're doing and how far out they are from their transplant surgery. We have the nurses get their weight in kilograms and their height in centimeters, and also the current dose of their medication, the prednisone and the Cellcept. And then we do calculation just on a calculator to be sure that their dose of prednisone, which is in the therapeutic range, and the dose of Cellcept is in the therapeutic range. The Cellcept is also dosed based on their body surface area, which is a calculation made from their weight and their height. And so our dose calculator will calculate the body surface area and then also calculate the prednisone dose in milligrams per kilogram per day and Cellcept in milligrams per meter squared per dose. So sometimes the clinic is very, very busy and chaotic, and doing a calculation by hand can sometimes get overlooked when things are running behind and things are busy. And that's not really a good thing, because many times the dose of medication may have been adjusted up or down for a variety of reasons. For example, the dose may be adjusted down if the patient is having problems with an opportunistic infection, like a viral infection, for example. And then once that infection is cleared, we should go back to the original dose of medication to help prevent rejection. And if that infection may have lasted for months, actually, it may be sort of easily forgotten about that the dose was lowered. And if you're not reassessing the dose, then that could be a problem. Also, our patients are pediatric patients, so they're continually growing, which is what we want to see. And they can sort of outgrow their dose of medications if the dose stays the same, but the patient's getting bigger. So I'm going to demonstrate my application using some real patient data from the clinic just this last week. I'm going to not use the patient's names to protect their privacy. But our first patient is a little 7-year-old boy who had a kidney transplant due to a congenital condition called nephrotic syndrome that he was born with. And when he came to the clinic, the nurses checked his height and weight and took his medication dose down. Sorry, I'm starting the program now. And this will just take a second to get started. So I also want to point out that the boxes here accept only accept only numbers and backspace initially, and then I realized when I was testing it that I needed a decimal point also for more accurate measurements, so I went back and put that in. So in our first patient, his weight was 23.7 kilograms. His height was 121 centimeters, and he's on 3 milligrams of prednisone per day, and his CellCept dose is 300 milligrams twice a day, but we only want to know per dose, so it's 300 milligrams per dose. When we hit calculate, we get the calculations back. So his body surface area is 0.89 meters squared. That's used to make the CellCept calculation, which comes out to be 336.1 milligrams per meter squared per dose, and his prednisone is 0.13 milligrams per kilogram per day. All these are in the therapeutic range, and you'll see if they're not, we get a message box that gives us a warning. Also notice that when we go to our next patient, and I delete this, the numbers in the labels down here will disappear. So I'm just going to delete that out. Our second patient is a 4-year-old girl who had a kidney transplant due to renal vein thrombosis that occurred when she was a newborn. In the clinic for follow-up, her weight was 18.96 kilograms. Her height is 100.3 centimeters. She's also on 3 milligrams of prednisone per day, but her CellCept dose is 150 milligrams per dose. And so we'll hit our calculate, and this time we got a message box warning that her CellCept dose is less than 250 milligrams per meter squared per dose. So that doesn't mean necessarily that we have to change it, but we have to go back and figure out why is it that low. Is there some reason? And if there's not, then we need to adjust it. But if there is a reason why, then that's fine. And then when we hit OK, we get the information: body surface area, the prednisone, milligrams per kilogram per day, and the CellCept dose, which again came back low based on our therapeutic range. And then I'll just do one more patient. And this is an 18-year-old male who has a kidney transplant due to a problem called IgA nephropathy. When he came to clinic recently, his weight was 81.92 kilograms. His height is 181 centimeters. He's on 5 milligrams of prednisone, and he is on 250 milligrams of CellCept. So we'll hit calculate, and we got a message box warning that his prednisone dose is less than 0.1 milligrams per kilogram per day, so we'll hit OK. And we get another warning that the CellCept dose is less than 250 milligrams per meter squared per day. We hit OK, and this then gives us the exact information. So he's on a low dose of both because he did have an infection with a virus called BK virus, which is damaging to the kidney transplant. So by lowering the immunosuppression, it helps the body to clear the virus. Once that's cleared, we could go back up on the dose of medication to prevent rejection. I'm going to go ahead and exit this and then go to the code so that you can just see a few key things. So here you can see that the text boxes will only accept the numbers, the backspace, and then again I had to put in the decimal point so that we could get a little bit more sensitive or accurate information. Again, it'll clear the labels when we change the text on the text boxes. And sorry, just trying to get it to go scroll down here. Come on. These are the calculations that we made based on the information we wanted, and these were all the variables. And I just wanted to show one more thing. This is our message box warnings. So it's if-then statements. And I put the labels with two significant figures after the decimal place for the BSA, body surface area, and the prednisone, because that is sort of what we need. But I didn't really need to have 2 decimal places for the CellCept dose, since those doses are a bigger number, basically. That many decimal places is sort of irrelevant. So I only did it to N1 for that. So again, that's my presentation. I hope you guys enjoyed it, and I really enjoyed having the programming class. I'm really happy that I took it and that I'm learning a little bit about programming, and I hope to continue learning more. So thanks again, everybody.